An ectopic pregnancy is one that is growing outside of the womb. If an ectopic pregnancy occurs, it will often grow in one of the fallopian tubes. Around 1% of pregnancies are ectopic. An ectopic pregnancy is a very serious and potentially life-threatening condition. We will provide you with information about ectopic pregnancy if your pregnancy test is positive, but the pregnancy may be so early that we cannot see it on the ultrasound scan. This is most common when the pregnancy is less than 5 weeks. If we cannot see the pregnancy on ultrasound, it may be that you have a normal pregnancy that is just too small to see on the ultrasound. It could be that the pregnancy has started but is no longer growing, a miscarriage, or it could be an ectopic pregnancy. The healthcare professional at BPAS will talk to you about the likelihood of these possibilities occurring based on your medical history. An ectopic pregnancy can happen to any woman. Some conditions make ectopic pregnancies more likely. These include having had an ectopic pregnancy or abdominal surgery in the past, having diseases that affect the fallopian tubes, having a history of pelvic inflammatory disease or PID, having an intrauterine device in place such as the copper coil or Mirena, being a smoker and older age. What happens now depends on your risk of ectopic pregnancy. If the healthcare professional feels that you are low risk, you can return for a repeat scan in a week. Using the ultrasound scan, the BPAS healthcare professional should be able to see whether the pregnancy is growing inside the womb. If the healthcare professional feels that you are at a higher risk, you will be referred right away to an early pregnancy assessment unit at an NHS hospital. They will be able to do blood tests or other tests to find out if the pregnancy is normal, a miscarriage or an ectopic. We can refer you to an early pregnancy assessment unit even if you are at low risk of ectopic pregnancy. Please tell the healthcare professional if you want this option. If you choose to come back to BPAS in a week for another scan, you should know about worrying signs or symptoms to watch out for. These are lower abdominal pain, especially from one side and severe, pain under the ribs or in the shoulders, fainting or feeling lightheaded, and vaginal bleeding. If you have any of these, seek medical advice immediately from your nearest A&E department, the BPAS aftercare line, or your GP. If you need any more information, you should speak to a BPAS healthcare professional, your GP, or ring the NHS on 111.